A woman in her 60s writes, "My friend is raving about testosterone gel. She says it's taken away all her pain during sex. Can I use this? And how do I get my hands on some?"
Well, the research does show that the hormone testosterone does improve sexual functioning in specific groups of women. But keep in mind the data on the safety and the effectiveness are really limited. The long-term study of testosterone therapy for women is really unknown. Unfortunately, most of the research is only done on men. So you have to keep in mind, given the limited amount of research on the effectiveness and safety, plus think about the potential serious side effects, you really need to give this some serious thought. But testosterone therapy might be appropriate for you if you have a reduced sex drive and estrogen therapy hasn't really relieved the symptoms. Or it may also help after you've had a surgically induced menopause at any age, that could happen. Or if you're postmenopausal, you're taking estrogen, and you're still having that decrease in sex drive without any other identifiable causes. I actually recently read a study that examined intravaginal testosterone therapy and postmenopausal women. This study focused on women that were incontinent or having bladder issues. So it was a placebo-controlled study where women self-administered the cream 3 times a week for 24 weeks. And then the researchers did find that it significantly improved sexual function. It also reduced pain with intercourse and just overall significant improvements in your sexual responsiveness, right? There was another huge meta-analysis study, large study of 48 different studies that they compiled into one. So we're examining over 8,000 women. And the research team found that the treatment had positive effects on desire, pleasure, and also led to a reduced anxiety about sex. So previous studies have suggested that testosterone may be an effective therapy for people with low sexual desire, particularly women. But the data is really, really limited. So you need to give this proper thought. Also, testosterone therapy comes in many different forms: creams, gels, patches, pills, and the safety risks and the method are dependent on the method of administration as well as how successful it is. So you really need to discuss the pros and cons with your doctor. Just remember, these are not like the ED medication. So this isn't like Viagra. So it doesn't really help treat like an acute symptom of sexual difficulty. It doesn't just trigger arousal in that moment. It's more of a long-term therapy.